everyone. We are going to go ahead and begin our examination today. Now, this will be a demonstrative scalp exam. I will be simulating to the class how to perform a proper annual assessment of the scalp and hairline areas, of course, also having a brief look at the ears as well as the neck and surrounding areas. Okay, now for the purposes of this examination, I will be simulating very specific concerns for our volunteer patient. I will also be demonstrating how to measure and fit our patient for a custom sleep mask, as she has been complaining of trouble sleeping. Okay, so why don't we go ahead and begin. Now I'd like to give a warm welcome and a gracious thank you to our volunteer, Sandra. She will be acting as our stand-in patient for today. I would like you all to keep in mind that during these simulation classes, we will treat our patient as if this were a real clinical experience, okay? So please maintain your professionalism, decorum, proper PPE, and protocol at all times when working with our volunteers. Okay, all right. So I am going to go ahead and begin with our mask fitting. As I stated, our patient has complained of trouble sleeping. Please keep in mind that for the purposes of this demonstration, our patient will not be verbalizing any specific concerns. These are things that we have discussed prior to, okay? All right. So I'm going to go ahead and gather supplies now. To start off with our mask fitting, I'm going to be obtaining a couple of measurements, and this is exactly what you would do in the real clinical setting, okay? So bear in mind that your hands should have been cleansed thoroughly, whether you're using soap and water or hand sanitizer, okay? All right. So starting with our tape measure, I'm going to obtain a base measurement of the circumference of her skull. So I like to start at one ear, bring the tape measure around, and Sandra's circumference is right around 22 inches, which is pretty standard. Okay, now I'm also going to measure from the halfway point just to ensure that we are recording an accurate reading, and that is about 11 inches there. So moving on to from about center earlobe to the corner of the eye, right at about 4 1/4. So slightly on the smaller side there. And of course, always obtaining bilateral measurements for the mask fitting because not everyone's face is perfectly symmetrical from both sides, okay? So again, corner of the eye to about center lobe, and on this side she is right about 4 inches, so we do have about a 1/4 inch difference there. Okay, so lastly I'm going to measure the distance between the center of the eyes, and I would say we're about 1.5 inches there. Okay. Also taking my calipers to further obtain measurements for symmetry. So starting on the right side, I'm going to measure from corner of the eye to about the pinna, approximating another 4 1/4 there. Now measuring orbital circumference this side. Now when measuring for eye cups, we want to make sure to measure both vertically and horizontally to ensure the most comfortable fit, okay? So just repeating that on this side. We are fairly symmetrical there. And again, about 4 inches here. Okay, perfect. So for the purposes of today's video, I will be using the Manta Sleep Silk Mask as well as the weighted mask. Now, the silk mask is made of a very soft and supple silk texture. It is very gentle on the skin, and this is something that I would recommend to patients that are prone to active acne or blemishes, as silk can be non-comedogenic and tends to not affect the skin as harshly as other fabrics. Okay, so to begin customizing Sandra's fit, I am going to match the measurements we obtained on her face to the measurements of our mask. Now, these masks are fully adjustable, completely customizable, so we are going to begin at the tail and measure down to about 11 inches, and that's where we'll be adjusting the eye cup on both sides. Okay, so I'm just going to do that here on both sides, and we are right at 11 inches. And then for our mid between the eye mark, I'm going to bring these in just a tad to about the 1.5 inch mark. So let me just adjust that here for Sandra. So just going to bring these in slightly. Perfect, okay. So Sandra has stated that she is a side sleeper, so I would like you to keep in mind that the Manta sleep masks all come with tapered sides as to not affect your comfortability while sleeping or lying on your side. I am also a side sleeper, so I do find that the tapered cups allow for a very comfortable sleep without putting extra pressure on the temple areas. Okay? So we are going to go ahead and fit our patient for her mask, and to do so, I'm just going to apply gently. Sandra, you will feel a gentle pressure sweeping over the eyes. Okay. I'm just going to bring that adjustable strap behind the head. Now we have measured that to fit her head specifically. We are at 22 inches there. Okay. Now it looks like we had a pretty good fit here. I'm just going to analyze where the cups lie and where the bridge of the nose falls in between the two C-shaped cups. Okay, so that does look like we have a very good fit. I would also like to note that all of Manta's masks are completely black out, which does not allow for any extra light to penetrate the orbital socket, okay? So I'm just going to test that feature here by introducing direct light underneath the cups. And as we can see, there's no light that is protruding to the top, so that's a very good sign. Same thing at the top, there is no light that protrudes through to the bottom, okay? So particularly helpful for any night shift workers or anyone who has sensitivity to light and just has trouble sleeping throughout the night, okay? All right, so I do want to try a secondary mask on Sandra, so let me just remove our silk mask. Okay, now this is a personal favorite of mine. This is the weighted mask, and I'm just going to re-measure here. So we do need to come in just slightly in the center. Sides are fairly even and in line with our measurements from earlier. And just ensuring that the width is also appropriate there. Okay. So I'm just going to bring these cups in slightly. Now again, on this mask it's more obvious, but I would like to show you the tapered cups and how they slope at the sides. It's a very comfortable fit there, and we do also have a nice placement for your lashes so they aren't being crushed by the weight of the mask. Now this mask is slightly heavier than the other, so it provides a gentle compression and is very helpful for migraine patients. So that is why I'm recommending this one to Sandra today. So I'm just gonna place this over your eyes just like the first one. And you are gonna feel a gentle pressure as the weight adjusts to your face. So this one does have a double strap in the back, which I quite like. I find it fairly comfortable as I'm sleeping. Now the fabric of the weighted mask is very soft and gentle on the skin. I also quite like the aesthetic of it. I think it looks very futuristic. So just ensuring that we have an adequate fit for our patient today. Now, I find that with the weighted mask, if you place it in the freezer for 10 to 15 minutes, it can provide a nice cooling sensation over the eyes. Okay? Having a look at Sandra, she looks beautiful in our Manta mask. And once again, I am going to test that blackout feature. Okay, so I'm just going to make a slight adjustment here. Perfect. All right. Okay, so I will go ahead and remove our second mask. Now, once again, I would like to thank Manta Sleep for sponsoring this portion of today's video. My audience can look either in the description box or in the pinned comment for 10% off with use of code SIESTA. Okay? All right, Sandra, so we are going to proceed with your scalp examination. And I want everyone in class today to remember that that is how we would demonstrate a mask fitting for migraine patients or patients with light sensitivity. Okay? All right, so moving on to the secondary portion of our examination, I'm going to begin with a visual inspection of Sandra's scalp. So I like to start off every examination with a basic visual inspection, as this allows you to get a better idea of anything external that could be going on, give you kind of a base of why your patient is in today. Okay, so I am going to start by shining my light over, just having a look at the hairline as well as the temporal areas, looking for any signs of notable abnormality of the skin, of the follicle, or of the hair. Also having a look at the ear and surrounding areas. So coming on to the left side, not noting any signs of abnormal discoloration or active flaking. I do see that our patient has a piercing. Now, as stated, she does have chronic migraines, and this piercing is to help dissipate some of the sensation of those migraines. So I love to see a natural remedy there. Also just having a look at the overall state of her hair. Now our patient's hair is very soft in texture. It does appear well cared for and very well manicured. I'm not noting any signs of abnormal breakage at the ends or excess splitting of the shaft. So coming up to the top, we're going to perform a visual inspection of different sections of the scalp. Okay, so in practice, you might have hair clips or items to separate your patient's scalp into sections. Obviously, this is a demonstration, so I won't be getting that in depth today, but I did just want to take note of that. So I am going to have a look at the bottom quadrant here, okay? So just making a delicate split of her hair, and I'm going to hold this up and just have a look here at this area of the scalp. Not noting any abnormality there, so scalp color is normal, no signs of abnormal texture. Okay, so making another part here just above about the corner of the brow. So again, making linear motions, visualizing the scalp's color, as well as looking for any signs of abnormal texture. Okay, so can anyone in class today tell me what I mean by abnormal texture? What exactly would I be looking for? Exactly, yes. So any signs of bumping or any abnormal kind of roughness or flaking, that would be considered abnormal texture, absolutely. Active dandruff, yes, absolutely. That would also be considered abnormal texture. Okay, so Sandra, I'm going to have you turn your head this way just slightly here. So looking at the left side of the scalp, can anyone else tell me what I would be looking for in terms of signs of infestation? Yes, lice, active lice, lice eggs, very good. Ticks, yes, if you have a very active outdoorsy patient, ticks would definitely be something that we would be looking for. Very good. Mites are a possibility as well, yes. Okay, no, luckily our patient today is not displaying any of those signs, so that's very good. Okay. So I'm going to go ahead and put our Penlight down, and we're going to move on to checking for temperature variation, okay? Now, I personally like to use a thermal gun. So this is a device that you point at the patient's skin. It does not have to come into contact with their skin in order for it to give you an effective reading, okay? So we are going to turn it on. I like to make sure that the sound is turned off, just because it tends to be a little loud and we don't want to cause our patient any distress. And then I like to do a practice reading on my hand to ensure that it's getting a normal reading there, okay? So of course you want to make sure that it's on the correct and appropriate setting. So starting on this side, we're going to be measuring several different areas. I'm going to start with the basic behind the ear, so about an inch away from the surface of the skin. And our first reading is 98.1, which is well within normal limits, okay? Going to test a variety of areas here, right at the temple. I like to test bilaterally to ensure that there are no major differences from one side to the other. So just returning her head midline here, testing that right side. Very good. Now I'm going to test right at the crown. Okay. And as well as in the nape of the neck. Down along the lymph nodes. Very good. Okay. So an average rating of about 97.9, which is well within normal limits. Okay. All right, so we are going to go ahead and move on, and at this point I would like to obtain a sample. So we would be obtaining a sample for several things. Now, for the purposes of our simulation today, I have previously discussed with Sandra that we will be obtaining a sample in order to test the protein in the follicle of her hair. Okay, so she has described some thinning of the hair and some worrisome shedding that is abnormal to her. So we are going to take a sample of her hair, ensure that the follicle is intact, and send that off to the lab so they can take a protein sample and let us know if she is in fact deficient. So remember, always keeping in line with your proper PPE protocol. If this were not a simulation, I would be going to the sink to wash my hands with soap and water. Okay? So we are going to pretend as if I have already done that. I'm going to place on a clean pair of gloves. They do not have to be sterile. Standard gloves are appropriate here. Okay? Okay, so once you have donned your gloves appropriately, we are going to have a look at our sample. So I have a small vacutainer here that I will just open. All right, so it just looks like this. We have the vacutainer and the top, and this will be used to secure the sample before it is sent off for testing. So to obtain the sample, I will be using a pair of tweezers. So I am just going to section off an area here. Now I try to avoid directly on the hairline. We will be only using one strand of hair, but along the hairline tends to be a little more sensitive. So we are going to just have a look at the side here. I will make a very gentle part in her hair. And you want to have a good look at the follicle to ensure that you are pulling directly from the root, as the follicle does have to be intact in order to obtain a proper sample. Okay? All right, so with our tweezers, we are going to grab one hair that you feel is an appropriate length and integrity. So I try to look for one that is a bit on the thicker side. And once you've obtained the hair in your tweezers, you can make sure that you aren't pulling out more than one. So we are going to gently but swiftly pull at the hair. Very good. So we have the sample hair. Going to determine that it does in fact have the follicle intact. Now, we don't need the length of the shaft, so I am just going to snip it to where it's about 1 inch long. Be sure that you cut the length of the hair and not from the follicle down, okay? And maintain the hair within my tweezers so that I don't lose it, and placing that directly in our sample container. This can be a little cumbersome. Just take your time. You don't want to lose the sample and then have to repluck. Okay? So once you have the sample obtained, of course, we are going to close it. Make sure you squeeze 3 times. Invert so that the liquid can fully penetrate the shaft. After obtaining the sample, be sure to place it directly in the bag. And of course, in a real clinical setting, we would be printing out patient labels that would then go down with this. Okay? All right. So let's go ahead and proceed to the next portion of our examination, and going to keep my gloves on for just a minute while I palpate Sandra's scalp. So I'm going to begin by asking for our patient's permission. So Sandra, is it okay if I go ahead and start to touch your scalp a little more in depth as we proceed with our exam? Perfect. So once you've obtained verbal consent, we are going to go ahead and begin. So I like to begin directly at the hairline. Now I'm using flat fingers to start, just placing my hands at the hairline, very gently palpating along, following down the sides. I like to go linear down towards the ears, apply very gentle pressure behind the ears, checking for any signs of edema there, which is not noted so far. So feeling along the bone structure, specifically behind the back of the neck, I tend to find some edematous areas here, so just making sure that there's nothing notable there. Now I'm going to just hold her hair in one hand so that I can better feel for the back of her neck. So following down along top of her spine here, feeling for any abnormalities along the vertebra there, which are not noted. And along with palpation, I am going to come down along her chain of nodes. So make sure that we are feeling for any signs of inflammation that could be either related or unrelated. Okay? So feeling for any signs of edema of the lymph nodes. Of course, following down the neck and then along the clavicle as well. Okay? So then we are going to fill within the scalp itself. So I like to use open hands and just go around very gently, notating any abnormalities that you feel. If you notice any bumps or lumps, obviously we would have a closer look at those. So luckily Sandra's head is fairly smooth. Now remember, in clinical practice you would be asking your patients if they've had any previous head injuries, if they've fallen recently, anything like that, okay? Alright, so I'm just going to continue our examination by studying the hair shaft itself. So you always want to test for hair integrity, specifically with patients who have complained of abnormal hair loss. Okay, so we're checking for things like protein deficiencies, any abnormality in the texture itself, if you notice any roughness of the hair shaft, things like that. So I'm just going to use a comb here. And you want to be very careful, ensure that you are not tangling your patient's hair. I like to ask my patients to come to their appointments with their hair down, if possible, and brushed. Now, please bear in mind cultural differences as well as differences in hair texture. If you have a patient with curly hair, you don't necessarily want to be combing through it roughly. So just be very gentle, assess your patient's individuality, okay? Ensure the comfortability of every single patient, and remember that not every appointment will be the same. Okay? So just taking a very small section here and just noting any abnormalities within the hair shaft. Now Sandra's hair is very, very soft. No roughness whatsoever. She also does not have any split ends. I always recommend that my patients get a haircut or a trim at least every 6 to 8 weeks. That's not always reasonable for everyone, but it is recommended to maintain the length of the hair. Obviously, personal preference also plays a factor there. I do notice that Sandra's hair holds quite a bit of static, but that's okay. Could also be from my gloves. And she does have a slight curl towards the end of her hair. So I'm going to look directly at the center part here, looking for any signs of redness, any damage from the sun. If you have a patient who tends to part their hair a certain way every day, specifically if they spend a lot of time outside, then you might find sun damage, and that would be a really good place to check for abnormalities of the skin like moles. Okay, so you can get moles on your scalp and they can be cancerous, so those aren't things that we want to overlook. So I'm just going to part a couple different sections here. Now, of course, keep in mind that this is not as thorough as your actual clinical experience, okay? So you should be looking at every area of the scalp as to not miss anything important. All right. Does anyone have any questions for me so far? Okay, very good. Make sure you all are taking notes because you will be quizzed on this later, okay? All right. That's a good question. Absolutely. So, as stated, I do like to inform my patients that it is best practice to arrive to their appointment with their hair down and in a style that allows for easier access to visualize the scalp. If for whatever reason you have a patient arrive in a hairstyle that's up and styled or maybe braided or whatever the case is, you can try to perform the examination to the best of your ability. You can also ask your patient if they're comfortable with you removing the hairstyle, and if not, you can ask if they're okay with rescheduling. So we don't want to miss anything or not perform as thorough of an examination because our patient is underprepared. Okay, so just very kindly ask for a reschedule and of course explain the reasoning why. It's all in their best interest. Okay, so that was a very good question. All right, so Sandra's hair is quite beautiful. So we are going to just remove any strands that we might have pulled out there. So I am noting just a little bit of hair loss there. So we got about 5 or 6 strands just with that little bit of combing, which tells me that she might have just a bit of a weakening at the follicle. So that sample would be quite helpful for her. So we can see if there is in fact a protein deficiency. All right, so I'm going to move on to testing for any areas of edema. Now I know you guys are familiar with this. We have discussed this tool at length. During a scalp exam, you do want to be very gentle as the area specifically around the hairline can be quite tender for some patients. Okay, so I do like to give them an example on an unaffected area. So Sandra, I'm going to be going in with this acupressure tool and you are going to feel a slight pressure just like this. Okay, I want you to let me know if any of the areas are particularly tender, and of course if anything is painful, please do let me know so we can have a closer look at that area specifically. So just going in here and applying a very gentle pressure. You only want to activate the tool just enough to where the spring loads. You don't want to push all the way in, not in this area specifically. So do be very careful. And if you feel you aren't that great with hand-eye coordination, this is something that would be good for you to test. And this is one of the tools that you can use to test at home. I have provided you with this in your kit. And you can use something like a makeup sponge to simulate skin. Make sure you weren't producing more than a 1 centimeter indent in the sponge. Could also use something like a soft orange peel. Anything that would simulate real skin, okay? So just practice your manipulation. We're only going in a tiny bit. Note any signs of swelling or edema. Not noting any abnormality there. So I'm going to move further back within the scalp now, and I do like to check quadrant by quadrant. So right now we are checking the top right. Then we will check the bottom right. Top left. And of course, bottom left. Very good. Okay. Yes, it does appear as if our office cat is taking a nap, and he is quite a loud snorer, so we like to just let him rest. I apologize if his snoring is slightly distracting. I think it's rather cute, but I might be a little biased. Okay. So I didn't notice any active flaking in Sandra's scalp, but if you did, or if you had a patient who was complaining of active dandruff or scalp psoriasis, or you noticed any abnormality of that texture we talked about earlier, you would go in with a couple different things. So just to give you a brief demonstration, I have a tool here. Now this is just a basic spoolie. We use it in several different procedures. I also have just an eyedropper, and this is going to allow me to produce a puff of air that would dislodge any potential skin flaking that she had. Okay? So I am going to go in and just very gently manipulate the skin here. So we are essentially agitating the area. So let's say, for example, she had an area of active flaking here. I would very, very gently go in with my spoolie. I'll show you guys on this side of the class as well. So I would just very gently go in with my spoolie. You don't want to comb too hard because these areas can tend to be more tender. So just enough to dislodge any of the dead skin cells. And then we can use our eyedropper to further assist here. Sometimes a back and forth of the spoolie and a little bit of air. And then once the sample has been dislodged, you can use your tweezers to obtain. And then you would obtain a sample just like we did with the hair. Okay? Very good. Now I can tell you questions pertaining to that will be on your test. So that is something I would take note of if you haven't already. Okay. All right, so we are going to move on to testing a bit of neurological response. Now, as you guys know, this is something I like to test with every single patient, regardless of the examination. Okay, so you never want to miss out on something that seems unrelated just because you don't think it's important or that it doesn't pertain to the examination. If it takes 30 seconds to test, then you should go ahead and test it. Okay, thorough is best. So I'm going to take my Reflex Hammer. And just to give you an example, Sandra, you are going to feel a gentle tapping along the hairline. Again, if you feel any discomfort, please do let me know. Okay? So because she has migraines, this test is particularly helpful for testing for any specifically affected areas. So we are going to just very gently tap, testing for any abnormality in the neurological response. Looking for any abnormality in her reflex responses, any abnormal blinking of the eyes that indicates an overactivity, and of course looking for any areas that are particularly painful to our patient specifically. So just going to turn your head slightly here. Now I want to show you that we are also going to test along the sides of the neck here. So migraine patients tend to have pain behind the ear, so we do want to percuss there, looking for any areas of tenderness. And of course we will test bilateral pain response, so just doing the same thing on the other side. Always very gentle pressure. This is a swinging motion, so just holding far back on the tool so you apply less pressure, and always using your hands as a buffer. Okay. All right, so no pain or tenderness noted with that, which is a very good sign. All right, we are almost done with our examination. In line with our neurological response testing, I'm going to check for sharp sensation. Okay, so particularly important for patients who are experiencing any signs of neurological deficit, or if you've noticed any abnormalities in pattern of speech, abnormal sensation, things like that. Okay, so of course, giving an example, especially with our sharp tools, we don't want to startle our patient. Okay, so Sandra, I'm going to be going in with a very sharp tool. I don't want to alarm you. It's not going to cause you any pain. It might be slightly uncomfortable as it is very sharp, but it will not penetrate the surface of the skin whatsoever. Okay, so just to give you an example here at the clavicle, you're going to feel a sharp sensation. Of course, let me know if it causes you any pain, and more so just checking for a lack or loss of sensation. So you should feel very sharp sensation here, and it should feel the same sharpness as we go down. Testing bilateral response on the right side, that should feel the same as on the left. Now, that should feel the same all the way down. And if we come all the way across, that should all feel about the same. Okay, now I'm going to test here at the nape of the neck. That should feel about the same in all of these areas. And if there's any difference in sensation, if any of these areas feel abnormal or feel any less, I would like you to let me know. Okay, so lastly, testing along the back of the neck all the way across the spine to the other side. Very good. Okay, now if your patient does note that they feel something slightly off or something feels abnormal, maybe one area didn't feel the same as the other, then obviously we would do further testing there. Okay? All right. So the very last thing I'm going to do for our patient today is perform a stethoscope assessment. Now, I'm going to go ahead and place this in my ears. Now, I am going to remove my gloves. Okay, so ensure that you have your stethoscope on the correct side. For scalp testing, we are not using the bell, we are using the flat surface. Okay, so we are going to begin by placing just below the ear. Just listening for any signs of abnormality here. Anything that could indicate a lack of blood flow, abnormal circulation. Very good. Testing bilaterally, of course. Very good perfusion, not noting any signs of abnormal circulation on the left side. It's going to test directly over the temple. Very good. Very good. And lastly, at the top of the crown. Perfect. Okay. All right, so that will conclude our scalp exam demonstration today. Now, again, we would like to thank Manta Sleep for sponsoring this video. Use code SIESTA at checkout for 10% off your purchase. I would like to thank our volunteer patient, Sandra, for allowing us to demonstrate these examinations today. And class, make sure you obtain your notes properly, coordinate with each other. I'd like you to get in your groups, and we are going to have a quiz on everything we went over today in about 25 minutes. Okay? All right. No, it will not be open book, so you can study your notes for the next 20 or so minutes, and then we will put them away for the test. I hope you were paying attention. Okay. Thank you, everyone.